Great. Well, good morning, everyone. It's 10 o'clock, so let's get started. Thank you so much for joining us today. Thanks again for joining our very first Focus on Aging legislative educational series. And thanks for taking the time to learn more about the 10 Missouri area agencies on aging. Excuse me. My name is Julie Peetz. I'm the executive director for the Missouri Association for Area Agencies on Aging, also known as MA4, and I will be the event moderator this morning. Today is the first of an ongoing series of calls that we hope will open the door to conversations between the area agencies on aging and our state representatives, senators, and their staff. On behalf of the area agencies on aging, we thank you for the work that you do. We greatly appreciate and value your support in representing aging adults in Missouri, and we hope to become a valuable resource for you and a partner with you. As you likely know, aging adults ages 60 and older are the fastest growing segment of the population, and we want to work together with you to ensure that Missouri is a great place for all of us as we age. I will ask each of our panelists some questions to better help us understand more about how dollars get to the area agencies on aging and to the senior centers here in Missouri. Before we jump in, I'd like to ask all participants who are joining on a device to change your screen to speaker view. To do this, you can move your mouse over the view icon in the top right corner of the screen and then click, then select speaker. This will make the speaker be in the full screen for the duration of the presentation. In addition, I'd like to ask all participants to turn your video or cameras off to conserve bandwidth. There will be an opportunity for the panelists to answer questions at the conclusion, so please use the chat feature at any time during the event to ask your questions. Michael Payton will be assisting me with monitoring the chat today. For those of you unfamiliar with the area agencies on aging, I will share some background about the important work this network does. Missouri has 10 area agencies on aging, which cover every county in the state of Missouri. I'm sorry, I see in the chat. Yes, please, if you could please turn your cameras off, that'll help us conserve bandwidth. Thank you. The area agencies on aging provide programs and services that help older adults and adults with disabilities remain safe and healthy in their environment of choice. Most Missourians know that area agencies provide home-delivered meals, and most have heard of senior centers. However, we often find that Missourians are not familiar with all of the valuable and meaningful services that the area agencies provide. For instance, did you know that area agencies provide information and assistance that older adults and adults with disabilities and their caregivers need to help them remain safe and healthy in their homes? And did you know that area agencies provide access to the transportation needed to help them get to medical services, senior centers, grocery stores, pharmacies, and social activities? Also, the area agencies provide access to disease prevention and health promotion programs, legal services, in-home services, including personal care and homemaker, family caregiver services, home modifications, and so much more. We plan to share more information on many of these topics in our future Focus on Aging meetings. Today, though, our focus is on how federal Older American Act dollars, Missouri general revenue dollars, and other funding gets to the area agencies on aging and the senior centers. Area agencies can provide access to services through contracts with providers in their planning and service area. They can provide the programs and services directly, or they can provide the program and services through a combination of contracts and direct services. You will hear from 3 executive directors today who each provide programs and services a little differently in each of their areas. The Mid-America Regional Council in the Kansas City area contracts all of their senior center services out. Region 10 in the Joplin area runs all of their senior centers directly. And SeniorAge in the Springfield area runs their senior centers through a combination of direct center and contracted centers. You will also hear from the Department of Health and Senior Services, Division of Senior and Disability Services. These staff will explain how the Division of Senior and Disability Services determines the funding for each area agency on aging, how the funds are transmitted to the agencies, and what oversight the division has over the area agencies. Now I'd like to jump in and introduce our esteemed panelists, including the area agency directors and the staff from the Division of Senior and Disability Services. Dr. Stowe, would you please introduce yourself?
Yes, thank you so much, Julie. And first, I just want to take an opportunity to thank you, the Missouri Association of Area Agencies on Aging, and the Division of Senior and Disability Services for collaborating on these sessions. It's truly an honor to be present today. I direct aging and adult services at the Mid-America Regional Council, and we serve the Kansas City region. So the counties that we serve in that area are Cass, Clay, Jackson, Platte, and Ray. And I'm going to hand it off to my colleague, Jennifer Shotwell.
Thank you, James. My name is Jennifer Shotwell. I'm the Executive Director for Region 10 Area Agency on Aging. We cover 4 counties in the extreme southwest of Missouri: Barton, Jasper, Newton, and McDonald. In those cities, we run 7 senior centers and a rural program for home delivered meals. Let's head a little bit to the east. Becca Fields, would you like to introduce yourself?
Hi, I'm Becca Fields with SeniorAge, and I am butted right next up to Jennifer in our region. We cover 17 counties in Southwest Missouri. Our administration office is here located in Springfield, and then we have 34 senior centers across our territory. And I think Kim.
Yes, good morning. Thank you for giving us the opportunity to join in the conversation today. My name is Kim Toebben, and I am Deputy Division Director at the Division of Senior and Disability Services. Along with the Older Americans Act, which we are here to talk about this morning, we also administer the Medicaid Home and Community-Based Services Program, including special health care needs for medically complex children, and the Money Follows the Person program. We also operate the Adult Protective Services Unit, which includes the Adult Abuse, Neglect, and Financial Exploitation Hotline, and several other programs that serve the older adult population and persons with disabilities. And I'm going to pass it over to my colleague, Jake Luebbering.
Thank you, Kim, and thank you for giving an overview of what we do here at the Division of Senior and Disability Services. My name is Jake Luebbering. I'm also a Deputy Division Director here at Senior and Disability Services. I've had the privilege of working in this division for approximately 7 years now, and it is a pleasure to be with you all here today. And I will pass it off to Becky Harris.
Thanks, Jake. As Jake said, I'm Becky Harris, and I work in the fiscal office for the Division in Senior Disability Services. I've been in this current position for almost 5 years now, and I directly oversee the distribution of the funding to the area agencies on aging. So I will hand it back over to Julie.
Thanks to all of you. Let's jump into our questions now. The Department of Health and Senior Services provides the primary funding for the area agencies on aging. Kim, could you tell us what funding does the Department of Health and Senior Services use to contract with the area agencies on aging?
Sure, Julie. The Division of Senior and Disability Services, as the designated state unit on aging, is the pass-through agency for the Older American Act funds that Missouri receives from the Administration for Community Living, the federal government. The Administration for Community Living specifically designates these funds for the area agencies on aging. While the state is allowed to keep up to 10% of the funds for our administrative use, the division has been able to pass at least half of that 10% back to the area agencies on aging for use on services due to the efficiencies of the division. The division also receives general revenue funding for the area agencies to provide meals and other services outlined in the budget bill. And in addition, the division also provides some of the social services block grant funds to the area agencies to provide transportation and meals to adults with disabilities.
Thank you for that explanation, Kim. Becky, could you tell us how the division determines the amount of funding for each of the 10 area agencies on aging in Missouri?
Sure, Julie. The Division of Senior and Disability Services uses an Administration for Community Living approved funding formula to determine the percentage of the overall funds that each area agency on aging will receive. This funding formula uses metrics such as individuals age 60 and older, individuals who are minorities with low incomes, individuals with low incomes living in rural areas, and similar factors in the formula to target those individuals with the greatest economic or social need. Using this formula ensures Missouri is meeting the requirements of the Older Americans Act. The area agencies on aging receive allotments for Title IIIB that provides access services such as information and assistance, legal assistance, transportation, and other in-home services. They also receive allotments for Title IIIC, which is nutrition services. These services include both congregate and home delivered meals, along with nutrition, education, and counseling. The agencies also receive allotments for Title IIID, which is disease prevention and health promotion programs. These programs must meet the Administration for Community Living standards of being highest level evidence-based. Family caregiver services are covered under Title IIIE. These services are available for several populations, and the general eligibility for these services, the family caregiver services, are the person cared for is age 60 plus, and the person providing the care is over the age of 18. There is also older relatives, including parents, age 55 and older, providing care to adults aged 18 to 59. Adult family members or other informal caregivers, age 18 and older, providing care to individuals of any age with Alzheimer's disease and related disorders, or grandparents or older adults that are not parents that are age 55 plus and caring for a grandchild under age 18. Finally, the area agencies receive Title VII funding for the Long-Term Care Ombudsman Program. These funds are used to advocate for individuals living in long-term care facilities.
Thanks, Becky. Now that we know more about the federal funding formula, Jake, could you tell us what are the area agencies on aging required to do with the funding that they receive from the Division of Senior and Disability Services?
Yes, Julie, the area agencies on aging are required to provide either directly or through contracts supports and services for individuals in their planning and service areas, which are needed to keep them safe and healthy in their environment of choice. Each of the different allotments Becky just spoke about have different requirements. The fiscal oversight responsibility of the division is to ensure that the funds provided to the area agencies on aging are spent in accordance with the Older Americans Act, U.S. Code, state statutes, state and federal regulations, and the contract language.
Thanks, Jake. Kim, Missouri has over 200 senior centers. Do the area agencies operate them directly?
Well, it's a mixture. The senior centers across the state are made up of a combination of the area agencies directly running them and the area agencies contracting with local entities to run the centers. Regardless of how the centers are operated, they are all required to follow the same rules and regulations required for the area agencies on aging to receive the funds from the division.
Thanks, Kim. Now we will move to how the area agencies on aging determine how much funding they will provide to their senior centers, either directly or contracted by the area agencies. Dr. Stowe, let's start with you. How does Mid-America Regional Council Area Agency on Aging determine how the funding for the senior centers in your planning and service area will be funded?
Thanks, Julie. Great question. And I think it's really important to state at the outset that we don't have any specific line item in our budget or funding for the senior centers. So it's really the Area Agency on Aging working to identify what services the senior centers are interested in offering. And then that's how we fund them, is according to those services and the titles in the Older Americans Act. And then those funds are passed through to the senior center. And at the Marks region, we undergo a competitive procurement process. It's public. It's through a request for proposals process. And interested senior centers will submit a proposal, and it will be reviewed by a panel of involved experts, staff, and others. And then we make a recommendation to contract with those centers. So we are really open to and always try to cultivate new centers. If there's a gap in service, if a county isn't fully served, we will go out to the community and try to encourage proposals into that process if it makes sense and they have an interest to do so. And we contract with a wide variety of entities, from nonprofits that are 501c3s according to the IRS tax code, to cities or other government entities that have maybe a community center or other center in which they can offer the services.
Okay, thanks so much, James. Jennifer, how about you? Same question to you, please.
Thank you, Julie. As Dr. Stowe pointed out, every year we put out an RFP to operate our senior centers. Historically, we have never had anyone bid on those contracts. So consequently, we operate our senior centers directly. Therefore, we don't really determine how much funding each senior center gets. It's basically in our budget that's developed every year. Because we use Title 3B, 3C1, C2, and Title 3D, Title 3E funds to accumulate the dollars necessary to run a senior center. Most of this is done in the budgeting process. We look at how many employees we have to retain to operate a senior center. In my area, minimum is 3, and that is in the very smallest areas. Do we have enough volunteers available to deliver Meals on Wheels, or do we have to hire a paid driver and provide them with a vehicle to do so? We also look at the age of the equipment that's in the senior center. Again, we have to purchase all of it. We have to maintain it, repair it. So the lifespan of that equipment very heavily weighs in our budgeting process. In addition to all of those business considerations, we also look at the communities we are in. We are specific to their needs. Because we are wrapping all of these different funding streams together to operate a senior center, we look at the available transportation. So, for example, Joplin operates the Sunshine Lamp Trolley, as well as the MAPS bus that helps people with disabilities get to our centers. So we don't heavily fund transportation in Joplin. In other areas, we rely heavily on OATS and some local transportation providers. We also look at the number of congregate diners, that's what we call them, because they come to congregate in our senior centers. Do we have a lot? Do we have more homebound than congregate that are going to be served out of that center? And that really drives the programming that we bring. Easy example, in Carl Junction, Missouri, we typically see less than 15 homebound senior citizens that are served nutrition from that senior center, but we may have 40 to 50 people come to lunch every day. So obviously we're going to place more in senior center programming for Carl Junction, whereas in Knoll, Missouri, we have 5 times the number of home delivered meal recipients. We need more in-home services in that area. Again, it's because of the Older Americans Act flexibility that we are able to tailor programs unique to the culture and the area that we provide programming in. And it's never easy, and there are always unexpected expenses. We rely heavily on our cities. In my area, we do not own any of our senior center buildings. That is a godsend because the cities we are in provide that space to us and the maintenance and upkeep of the building itself. We come in completely, put all the equipment in the kitchens and run all the programs. But not having that burden of, in some cases, even the utilities are paid by the city, allows us to continue to operate in the locations that we do. the Older Americans Act, in my opinion, and the provision of senior centers under those funds is truly a marriage of federal, state, county, local, and agency cooperation. In addition to we heavily relying on the seniors themselves and their input. So, thank you.
Thanks, Jennifer. That's great to hear. Becca, same question to you. It's SeniorAge.
Yes, thank you, Julie. And as was mentioned, we share similarities with both Mark region and Jennifer's region as well. We have some direct centers, and those are funded through the direct provision of staff wages and benefits. And to determine, kind of, as Jennifer was saying, that the level of staffing needed, we look at how many meals they're providing, both home delivered and congregate meals, how many people attend various activities to determine how many staff members we need for that center. And then we also purchase, of course, all of the raw food products that go into those meals, as well as home delivered frozen meals that are to be sent out by that particular center. And then we're certainly willing to consider a portion of the operating cost, just that amount that it takes for the center to keep running. So that's a little bit about our direct senior centers. And of course, in the direct senior centers as well, we also really rely on those senior center boards and other community supports to help fundraise, provide volunteers in those communities. As far as our grant and contract senior centers, those are awarded through a yearly application process. And similar to how we determine, our direct centers, we have sort of a similar matrix that takes into account several different items, so we can sort of standardize that process and be fair across the board when we're awarding funding. And in that matrix, we consider factors such as, are they going to be one of the participants in our home delivered meal program? Are they going to help get those meals that end mile to the participants themselves? And also we take into consideration a portion of their operating costs. Also, how many seniors typically receive service, and a projection of the service units to be provided. So once all that information is sort of compiled, we look at our budget first to see what funds we anticipate having to award. And then they're awarded a contract amount for that year. And then as they deliver monthly services, they provide for us an invoice and proof of service. And then we provide 1/12 reimbursement per month for those senior centers. And again, in these communities, we also really rely on, grant partners and community support to really wrap around our funding to be able to make the services go further in those communities. And then we provide a team of sort of wraparound services with our care coordinators to make sure that care coordination is also provided in each of our service areas.
Great. Thanks so much, Becca. Yeah, it's really interesting how every area is so different and really serves the local community. Now that we know how the senior centers are allocated funding from the area agencies, let's talk about what the senior centers are required to do with the funding that they receive. Becca, let's start with you this time.
Okay. Like I mentioned, with our various levels of support, if a senior center has agreed to do the home delivered meal portion of the program, then we will certainly look to make sure that they have the capacity and the support in place that they need to be able to fulfill that responsibility to get those home delivered meals out. And that goes for direct and contract senior centers if the contract senior center is providing that particular service. And then really with both of them, they provide a wide array of services, including, has been mentioned, information and assistance opportunities. And I know we've mentioned wellness opportunities, also telephone reassurance, and just other things, again, as Jennifer mentioned, sort of tailored to what that community needs. And then we go in and we monitor each of these locations every year to make sure that they are fulfilling the requirements that we are expecting of them.
Thanks so much, Becca. Jennifer, same question for you.
We directly provide services at all of our senior centers. However, how we determine what programming that is going to be is basically internal decision-making. Starts first and foremost on the budget that we receive through our allotment table percentage that Becky described. Once we know the estimated dollars, myself and my chief financial officer meets with our nutrition director, senior center managers, my board of directors, who in my 4 counties includes the commissioners of those counties. We go around to the city council meetings and visit with local leadership to determine needs. We also get a lot of input from our seniors themselves, whether they're on the advisory board or through comments at the senior centers. But all of the services that we provide are pretty much wrapped up in the area plan that we write every year in conjunction with the state plan that gives us the goals of where we should be looking in our senior communities and to fulfill their needs. We try to make available all of the titled categories at each of our senior centers. And if it's not on site, it's within a phone call and an appointment to receive Medicare counseling, to receive chronic disease management, education opportunities, legal help. We do information and assistance at each of our senior centers.
Thanks so much, Jennifer. James, same question for you.
Sure, thank you. My answer is very similar to Jennifer and Becca's answers, but the only thing I'll add is we accomplish our expectations for senior centers through our contracts. And so there are regulations that the contracts outline related to the different services, what the meals must be comprised of, et cetera, and they'll meet those. And then there's a lot of latitude on what this center does above and beyond those services that are specifically funded and regulated. And that's really a collaboration between the center and Mark about what meets the best needs of their local community, what their staffing is like to provide different services. And we try to afford a lot of flexibility for how the senior center operates beyond those basic requirements that are outlined in the contract.
Thanks so much, James. Now let's turn the talk to meals, since meals are the largest service category for the area agencies on aging. Kim, can you tell us, can the area agencies provide any meal that they want, or are there requirements for the meals that they can provide?
Sure, Julie, thank you for asking this. Good nutrition is vital for the overall health of our older population and is very important to the division as a staple at the area agencies on aging. The Older Americans Act requires that all meals produced with Older American Act funds meet 1/3 of the required daily nutrients for older adults as defined by federal guidance, meet food safety requirements, and be appealing to older adults. Those meals are provided either through congregate meals within the senior centers or via meals delivered to participants' homes. Basically, the food needs to be healthy, safe, and appealing and meet the nutritional needs of those in their specific regions.
Thanks, Kim. Becky, we get this question a lot. Can seniors contribute toward their meals and other services?
Yes, while an eligible person is not required to pay for a meal or service in order to receive assistance, individuals are allowed to contribute towards the meal or services they receive. Providing a donation, no matter how small, enables more individuals to be served in the planning and service areas.
Thanks so much, Becky. Now I'd like to open up to answer any questions from the chat. I see one question. Is there a limit on the income of the older adult who may need various services? It's a question we hear often, that they feel, sometimes people feel that they make too much money to participate. James, would you mind answering that?
Sorry, thank you. Yes, absolutely. No, we don't do means testing for our clients as regarding income. So the priority is really put onto those who are the highest social and economic need. And generally, those are the type of folks that we primarily serve for the most part in our senior centers. We do have an assessment that kind of helps our senior centers take a broad look at the participants and make some of those decisions but you don't have to meet certain income thresholds to participate in Older Americans Act services. The act was specifically designed to take that pressure off of participants and allow a broad spectrum of older people get the help they need without going through a lot of hoops.
Thanks so much. I see another question. How does a senior center become an area agency on aging operated senior center that is eligible to receive this Older American Act and general revenue funding through the area agencies that we just learned about? This is a great question. Jennifer, could you answer this one?
Again, since currently we directly operate all of our senior centers in Region 10, we already have senior centers in the largest towns. Keep in mind, Southwest Missouri is primarily rural. We have senior centers in Lamar, Carthage, Webb City, Carl Junction, Joplin, Neosho, and Knoll. Basically everywhere within those counties that seniors would need to get to shop, to bank, to hit the post office. Because every town would love to have its own senior center, we would love to have unlimited funding to be able to provide that. Unfortunately, we do not. The cost of labor, the cost of equipment, the cost of buildings and building maintenance may be too high for a city to contribute for our programs. And just the rural nature of the counties that I serve. For example, McDonald County, I think our largest city is Knoll. It has 1,800 people. So to expend that much funding for a town that maybe has 300 or 400 people is just out of reach currently with our funding. We are in Region 10 doing a pilot program that is new to us. It may not be new to my sister AAAs in Missouri, but we are seeing with the rise in gas prices that seniors just can't afford in those rural areas to drive 20 miles each way to get to our senior centers. So we are trying to bring the senior center programming to those areas. For example, we have a small town in far eastern Newton County. It's about 30 miles to the closest senior center, either way, whether it crosses over into SeniorAge's district or my own. So we are working with them, with this little city, to come up with a committed board to adhere to the statutes. We would cater food in, and basically they would take over the responsibility of maintaining the food safety, the data collection for us. And then periodically we could actually bring some programming to that area. We could find volunteers to sponsor bingo, for example, or do some educational programming in that facility. But with the average of 3 full-time employees per site, the labor alone is just beyond what we are currently funded. So yeah, we try everything. We again heavily fund transportation. We try to work with the transportation providers to get seniors to our centers wherever we are. But we have some thriving senior centers that are not area agency on aging senior centers in my district. And unfortunately, again, it's funding constraints why we can't just take them on. James, Becca, do you have any comment on that?
I think you did a great job answering that, Jennifer. It's, very similar for us. We, of course, have a certain budget, and we have to think long term. It's great right now that we've got some influx of one-time funding in our budgets, and we're so grateful for that. To make some important one-time purchases. Jennifer mentioned equipment. That's a huge one that will have a lasting impact. But we have to think beyond those one-time funds and what can we sustain for the long term. So that's certainly something that we think of. Fortunately, we do have some local funding through some of our county tax boards that has allowed us to expand services and try, similar to what Jennifer is talking about, some outreach programs in some of the areas that we don't have an actual physical senior center, but we're able to go out into those communities, provide a meal, provide resources, information, and care coordination in those areas too.
Great, thanks, all of you. I don't see any more questions. If there are any last minute questions, drop them in the chat pretty quickly. But I want to thank everyone, each of our panelists for joining us today. I also want to thank the legislators and your staff who have taken the time to learn more about the area agencies on aging. Before we wrap up, I want to remind you that we will be doing quarterly calls regarding program and services provided by the area agencies on aging. Please reach out to me if there's a topic that you're interested in hearing more about. My contact information, as well as the link to the MA4 webpage is in the chat box. That also, our webpage will also direct you to your local areas as well. I think we're going to pull up a copy of the map with the representative areas, if that's possible. And I do see another question. Do we make sure that each county is served in each region? Yes, the AAA serve every county in the region. James or Jennifer, Becca, would you want to cover that a little more?
Yeah, I'll jump in and then my colleagues can fill in. We do have sort of a mandate, really our expectation through our the regulations and law that we would cover all counties in our what's called a planning and service area. And that's what each AAA is assigned to cover, AAA Area Agency on Aging, sorry. It may not result, however, in a senior center in each and every county. Just that services are offered, and sometimes we'll have the adjacent county have folks transported over. So there is some, it doesn't necessarily mean a senior center will be placed in each county, even if services in general are offered in each county.
I also want to chime in on that. Primarily, the home delivered meal program is one that does reach throughout the state of Missouri. I am not aware of any area that does not have home delivered meal services in it. My area does not. We cover from county line to county line as best we can. And we struggle to maintain that without wait lists and rely heavily on local funding in order to continue to provide those services. Anyone else want to chime in on that one, Becca?
My answer aligns with yours as well. You know, right now, currently, we do have a senior center that's either a contract grant center or a direct center in every county. You know, I don't know if we'll be able to sustain that for long term. But we do, of course, ensure that every senior in every county has access to information assistance, care coordination. And, you know, we work really hard to, like I said, kind of diversify those funding streams so that, you know, the Older Americans Act dollar is sort of looked at as the last resort. You know, we'll try as best we can to serve folks out of any other funding stream. We apply for grants to supplement funding to just try to make our services go even further.
Thanks. Another question, a big one. Can you address the $15 million for frozen meals put in the fiscal year 23 budget? Where will these be produced and how will they be distributed?
I'll go ahead and take a crack at that, and maybe our partners from the division would like to jump in as well. This is in reference to a piece of legislation that, to my knowledge, has not been signed by the governor yet. So I'm sure that additional details will be forthcoming as the division works through that initiative. However, what we do know is this was a remarkable transformative initiative that happened during COVID. And our sister area agency on aging, SeniorAge, started an effort to offer emergency relief by producing and distributing frozen meals to some of the area agencies on aging. Mark was one of their early customers, really in need of additional food supply in the Kansas City region, as so many of our older people went back to self-isolation and needed home delivered meals to sustain them. And this was noticed. This amazing initiative was noticed, and it got some legislative backing. And so the funding is really designed to solidify that model, which is area agency on aging owned and community driven, because community partners come to the table to help make sure those meals make it to the doorstep of customers and participants. So it's really to solidify that service and scale it as an option an additional option of food sourcing for the area agencies on aging across the state, if it fits into their procurement models and it fits into the local context. As we've mentioned so much before in today's session, the local context and what happens on the ground in any one area really drives what services are selected and the models of services that are provided. But I'll invite our division partners and see if they have any further comments.
Thank you for that explanation, James. Kim, you feel free to jump in as well. I thought I'd add on to what James had said, and specifically address the question of where will they be produced and how distributed. So we are in the initial talks in collaboration with all 10 of the area agencies on aging here in the state of Missouri. We recently all convened here in Jefferson City and began those discussions about how this entire initiative would be structured. And so the division is taking the role of facilitating that collaboration between all 10 area agencies on aging so that these funds can be best put to use to serve the entire state of Missouri. And Kim or James or anyone else, if you'd like to add in a little bit on that as well, feel free.
I would like to add one driver for my agency to be supportive of this funding. Right at the beginning of COVID, our commercial meal vendor pulled their contract. And for the first time in 40 years, I would have been unable to deliver meals to homebound senior citizens. My average is $5,000 to $6,000 a week, or 5,000 to 6,000 meals a week. And it was a shot in the gut. It really was. So because SeniorAge had been toying with a program to do this within their own area agency on aging, I called them and they were able to provide these meals and take up for that complete void in my supply chain. And as we know, over the last 2 years, 2.5 years, that supply chain has still not settled down. The commercial entities of the world are in flux. They either can't find employees, they can't find food products, they can't find logistics support, they can't. And I take the responsibility for my seniors in my area, and I applaud the state for the interest in making sure that the seniors in the state receive that meal without delay. When was the last time you thought, I'm not going to eat today? You know, I take that very seriously. So just a little context as far as why we are so supportive and thankful that the state's looking at this, because I don't want to have that situation where somebody doesn't eat today because a commercial vendor decides that another contract is more worthy than mine.
Absolutely. And I just wanted to add from the state's perspective that this funding was really an opportunity to enhance the infrastructure that's in place across the state, that infrastructure that could not be funded by the Older Americans Act, so that those Older Americans Act funds can be directed to the services and the actual meals that are needed to go directly to the seniors across the state. So the budget line item that you're addressing is really just for that building that infrastructure and that possibility of expanding it across the state.
Thanks so much. I see one last question. We're getting close to the end of time here, but quickly, could someone, one of the directors answer, when determining what meals are prepared, are the seniors' needs considered? For example, not being able to eat hard or spicy foods?
Yeah, I'll be happy to jump in on that one, Julie. We do regular surveying of our meal participants to determine, what are the favorite meals. We get lots of feedback on those meals, and we try our best to accommodate a wide variety of preferences. We do have some capability, sort of depending on how much labor we have in the senior center, to tailor it to specific dietary needs. We try to do that as much as possible. And Right now, I will say that due to supply chain shortages, which are severe in our food program, sometimes it's just we've got to get, a very similar item in that meal and get it sent out. And it may not be the exact, thing that they're expecting. We try to match the meals as much as possible, but I will be honest that it is significantly challenging right now, and just getting food in our facilities to get out to seniors.
Thanks, Becca. One final question. This is a great question. In addition to more money, what else could the legislature do to aid the AAAs? For example, relaxation of certain rules, more flexibility in operations, etc.
One thing I would say, this is a great question, and I just want to note that the State Unit on Aging, and I'm not just saying this because our partners are on the call, but they are very collaborative and amicable to the needs and concerns of the AAAs, and we have open communication. It's frank communication, and it's very constructive. So if we have an issue, we can bring it to the state and feel like we'll be respected and heard, and I think likewise on the part of the AAAs, and we'll respond to the State Unit on Aging, which is the Division of Senior and Disability Services, should they have a request or concern. But some of the most effective things that the state has done, even the meal initiative that was mentioned, it's a recognition of the restrictions of the Older Americans Act funding and the areas in which that cannot be utilized effectively because of regulations, constraints on budget, et cetera, and where they can come beside us with opening those doors for partnership, flexibility with new models, or the time to explore a new approach to service. In my view, those are some of the most effective things that the legislature can do.
I'd like to take this opportunity just to mention that the Senior Growth and Development Program that was passed in 2019, and unfortunately was one of the initial withholds due to COVID. Very understandably, we didn't know what was going to happen moving into that time frame. But when I talk about long-term sustainability for services and programs, that would significantly help all of the AAAs and the senior centers. And so getting that, the bill itself is passed, but like I said, the funds were withheld. So if we can get that funding reinstated in next year's budget, that would certainly be very appreciated.
We also advocate very well to our national elected leaders. We are seeking change in some outdated language under the Older Americans Act federally. Primarily, one of the biggest asks we have is to allow takeout meals. We are prohibited from allowing food to be taken out of our senior center to consume. And a lot of people don't understand that. So we would love for you to champion our requests to our federal elected representatives and senators. MA4 puts together that information and we distribute that. But again, I echo James applauding the division and the department for always being willing to work with us.
Well, thanks. I think we're drawing close to the end of our time today. So I just want to thank all of you. Thank you to all of the panelists. Thank you to all of you for joining us. I'm so glad to have this conversation, and please mark your calendars for our next session, which will be Tuesday, September 20th at 10 a.m., where we will discuss some more of the many services that the area agencies provide. Again, thank you for joining today. We appreciate your participation and interest in learning more about the programs and services for Missouri's most valuable asset, our seniors. And please feel free to reach out to any of us. You can go to any of our websites. You can contact any of us directly, but we're here to partner with you and to work with you. Thank you so much for your time.